Hospice and community care workers like you are committed to providing quality health care to each and every patient every day. These patients depend on you for so much, from their most basic needs to the companionship you offer them. But you're also their protector. Sometimes you're the only one who cares for them. Or you may be part of a team of caregivers, friends, or family members who provide care. Anyone young or old who depends on other people to meet their basic needs are put into a position of vulnerability. Unfortunately, this vulnerability puts children and adults at risk every day. According to the National Center for Elder Abuse, almost 2 million Americans aged 65 or older have been injured, exploited, or otherwise mistreated by someone who they depended on for care or protection. For every case of elder abuse that is reported, 5 more will go unreported. More than 2.5 million cases of child abuse and neglect are reported each year. The nonprofit organization Child Help says that 35% of these cases involve physical abuse, 15% involve sexual abuse, and 50% involve neglect. About 1 in 20 children is physically abused each year, and 4 children die each day as a result of abuse. 3 out of 4 of these victims are under the age of 4. These statistics are shocking, but they help us recognize the hidden epidemic of abuse in this country. Abuse occurs at every socioeconomic level, across ethnic and cultural lines, within all religions, and at all levels of education. In your role as a caregiver, you are in a unique position to recognize the signs of abuse, to document them, and to report them immediately. Because you are in such a position, you need to know the different types of abuse, how to recognize the warning signs, and the policies and procedures to follow when you discover abuse. You will also learn about the standard and practices used by your organization to prevent abuse within its workplace. This presentation is just one part of your organization's training on recognizing and reporting abuse. Upon completion of your training, you'll be asked to sign a document stating that you understand your organization's policies and reporting procedures and that you will adhere to all these requirements. This is how much of a priority we as an organization place on abuse prevention.
Abuse can be very quiet, and nobody will know what's happening. Nobody in the neighborhood will know that they have a problem next door. And it's very important that we find these things out. If it were my mother, I would want somebody to know there was a problem.
You know, they need an advocate because they can't be an advocate for themselves, and you know, somebody has to do it, and if you don't, you know, the situation's only going to get worse.
It never ceases to impact on me when I see an abuse case or an exploitation case. It sounds crazy to say it hurts you as much as it does them, but we do suffer through these cases with people.
The first step in understanding what to look for in cases of abuse is to know the different types of abuse that can occur. The National Center on Elder Abuse recognizes 7 types of abuse: physical abuse, sexual abuse, emotional abuse, financial exploitation, neglect, abandonment, and self-neglect. You may recognize multiple types of abuse in a single situation. As in any case, you must always document and report any abuse you find. Physical abuse is defined as physical force that may result in bodily injury, physical pain, or impairment. Signs of physical abuse can include injuries such as bruises, burns, and broken bones. In many cases, emotional or psychological conditions such as anxiety or depression may also develop as a result of repeated physical abuse. When someone is being physically abused, the frequent occurrence of bruising is the most common sign. When assessing a patient or providing routine care, you should be alert to such signs. Bruising occurring on the face, head, back, arms, genital area, thighs, or buttocks should be considered suspicious in both adults and children. If bruises are identified, it is important to document the size, shape, color, and location of the bruise in the patient record. The shape may be important if abuse is suspected, since it could help to identify how the bruise occurred, such as by a fist or a belt. Abuse involving objects may indicate an escalation of violence. Burns may also be a sign of physical abuse or neglect. Burns can be caused by chemicals, cigarettes, heat sources, or water. Any sign of injury that is identified during a physical assessment or the normal delivery of care should result in the completion of an incident report. This will help to identify injuries that were present upon assessment and not the result of care that you provided.
You know, we had a patient who was being physically abused by their daughter, and the stories just didn't coincide. I wasn't working on that case, but I know that it just was a red flag for the social worker. She had many bruises on her.
Elderly people, patients bruise very easily, so we're looking for bruises that would not be in the typical areas, and then document that and then talk to the family. And we're looking at the patient will not only have bruises, but they're not talking as much, they're more withdrawn, or they're clinging to us because they're scared.
You just have to be very perceptive and look at the whole situation. When you're in a situation, you look for not only the physical outward signs, I mean bruising, of course, broken bones, things like that are very clear evidence. You also are looking for people that they're looking fearful, or they're not looking at the person that is their caregiver, or they shy away from them when they try to touch them. Sometimes just what they say, their emotional behavior. Sometimes people get really scared and they cry or they laugh inappropriately. So you're always looking to see what's going on.
Sexual abuse is any inappropriate sexual contact of a criminal nature or interaction for gratification of the caregiver who is responsible for the individual's care. This includes sexual molestation, sexual assault, sexual exploitation, or sexual injury. This dehumanizing form of abuse steals the self-respect of those being abused. With this kind of abuse, it's difficult for the abused to tell anyone due to shame and guilt. Many children don't know any better, and adults do not want to talk about it. There are usually both physical and emotional or behavioral signs when someone is being sexually abused. Physical evidence might include pain or itching in the genital area, bruising or bleeding of the external genitalia, torn or stained underwear, and difficulty walking. Behavioral signs of sexual abuse include a reluctance to be left alone with a particular person, fear of touch, or apprehension when sex is brought up. Any one of these behaviors alone may not lead you to recognize that a person is being sexually abused, which makes it even more important to be observant of both physical injuries and emotional changes. Sexual abuse is often perpetrated by someone who is known to the abused individual. Unfortunately, sometimes it is the healthcare provider themselves who commits the abuse. Community-based programs such as home care, daycare, and bereavement programs often serve vulnerable populations. Care within the home or in a more private setting allows access and creates potential for an abuse situation to occur. As healthcare providers, we must also be alert to this possibility.
With elderly abuse, it's different. They're more, I think they react differently, whereas they kind of go into a shell and they really don't say much of anything. And they just kind of keep it to themselves, and they really have a huge fear of telling anybody because they're so helpless, especially if they're bedbound and things like that, that you know, they fear if they report it, it's only going to get worse.
Emotional abuse can be difficult to detect and document. It is defined as infliction of anguish, pain, or distress through verbal or nonverbal acts. This is something that systematically wears away the victim's self-confidence, sense of worth, trust in their own perceptions, and self-concept. Emotional abuse usually accompanies the other types of abuse. At the core of emotional abuse is control. Any type of abuse that is not physical in nature can be considered emotional abuse, which can include verbal abuse and constant criticisms, as well as more subtle cruelties such as repeated disapproval or even the refusal to ever be pleased. This kind of abuse slowly eats away at the person's self-esteem until they are incapable of judging situations realistically. Belittling, threats, and other uses of power and control, often by family members, are indicators of verbal or emotional abuse. Common signs of emotional abuse include depression, unexplained withdrawal from normal activities, or a sudden change in alertness.
What I look for is that the family is using the money that is the patient's money for the patient's care. And so when we do an assessment and we know that the patient has savings and they have a Social Security check coming in, but then the family tells me that they can't pay for private duty to help with the patient's care in the home, then we look into, where the money's going to. What I've found is I've had cases where the family will justify spending the patient's money on their own car insurance or on other things for themselves. And when you come down to it, that's not for the patient.
Financial or material exploitation usually occurs with the elderly population. Some of the more common ways this happens is through theft, fraud, or embezzlement, as well as fraudulent use of power of attorney, loans obtained under pressure or threats, forced sale of belongings, using the victim's ATM cards, or check cashing by an authorized person for their own personal needs. Any one of these actions may be part of financial exploitation. This kind of abuse can be very hard to observe. The elderly person may not even know that they are slowly losing money and the control of their finances. Signs of financial exploitation can be difficult to detect because many family members do mean well when they take over the responsibilities for their loved one. But look for signs of other types of abuse, such as physical or emotional abuse, in conjunction with the unexplained bank withdrawals, checking account balances lower than expected or recorded in the checkbook, and sudden changes in their overall financial situation.
Several years ago, I had a patient who was an end-stage Alzheimer's patient. She was being cared for by her husband at home, and she was going through the periods of dysphagia where she was having trouble swallowing, and he was in denial. He didn't want to recognize that, and when we told him, not to feed her, he continued to feed her even though she was coughing and having problems swallowing. Well, the staff member was actually there and could see it, and could see the signs that she wasn't swallowing and was coughing, and as she instructed to stop, he continued, and which is, of course you don't want to do that because of that risk of aspiration, but it was just because of his denial of the situation.
Neglect is a refusal or failure to fulfill any part of a person's obligations or duties to a vulnerable individual. This is a very common type of abuse that happens to both children and the elderly. Neglect comes in the form of not providing the basic necessities, such as food, clothing, shelter, educational support, and medical care, or not providing adequate supervision. There are specific signs that a person is neglected. Dirty hair and skin and body odor show that an individual is not being bathed. They may be wearing clothes that are old, dirty, too big or too small, and not appropriate for the weather or situation. In adults, bed sores and sudden or unexplained weight loss can be additional signs. These problems are often identified by the home care provider during periodic visits to the home or residence. Evidence of neglect that leads to a patient safety concern would require notification of adult or child protective services.
I got a referral. We had a patient going into long-term care, and I went out, and the woman was not only being physically abused, which was evident by the numerous bruises that she had, but she was being neglected. She was not eating well. Her hair was a mess. Her clothes were all unkempt, and she also wasn't being taken care of financially. Her son was keeping her at home so that he could take care of her, but he was not taking very good care of her, but he wanted her to pay her check, her Social Security check, so he could keep the house going. And I called Office of Aging and got Protective Services involved, and we removed her from the home, put her into a skilled nursing facility.
Abandonment is desertion by an individual who has a physical custody of an individual or by a person who has assumed responsibility for providing care. The signs will be similar to neglect: poor hygiene, dirty clothes, weight loss, and in adults, bed sores. You will need to ask questions to confirm abandonment. Questions like, did your daughter come by this week? When did you last see your son? Where is your mom right now? Did you see your dad this morning? You may not have heard of self-neglect, and it may seem strange that someone else's behavior can cause an individual to neglect themselves, but it is common. Self-neglect can result from other types of abuse, such as a sexually abused child who stops bathing or eating or begins to